Hello viewers, welcome to another edition of National Focus. I'm your presenter Tarnia Green. Topping the headlines, more healthcare providers trained on how to provide voluntary counseling and testing services to HIV and AIDS clients. Dominica doing well based on new water and sanitation report, and work on the wing bridge linking Trafalgar to Watton-Waven nears completion. Stay with me for the details of these and other stories coming up right after the break.
The black Sikatuka fungus can survive on banana and plantain leaves even after they have been cut from the tree. Farmers and hucksters are encouraged to use alternate cushioning material when moving produce from farm to the market. Do not use banana and plantain leaves as cushioning. It is against the law to move banana and plantain trash from the field. Obey the law and stop the spread of black Sikatuka today.
Thanks for staying with us. Time now for the details of the news. Work on the wing bridge linking the village of Trafalgar to Watton-Waven is nearing completion. That project became necessary following the collapse of the bridge due to road edge failure in that area. The wings of the bridge were undermined by the river as a result of heavy rainfall a few months ago. The restorative work on the bridge is costing government over $140,000. Parliamentary representative for the Rosa Valley constituency, Honorable Dr. John Colin McIntyre, is happy to report that work on the project is at an advanced stage.
I'm happy that we are actually constructing the wing of that bridge right now. Pretty sturdy, solid piece of concrete work going on there. And of course, it's being done by our Watton-Waven contractors. Speak here of people like Mr. Robinson, Robo Xavier, and of course Mr. Prince. They're the main ones in terms of the contractors working on that. We don't have to go outside of the area to get expertise. It exists right here. And what the guys are doing, I mean, it's a tremendous job. And I mean, it's very scientific. We also had the development along the edge failure on that road as well too. All carried by the same crew, Mr. Xavier, Mr. Prince, headed by Mr. Alvin Charles, another major contractor there. And we have a number of skilled people in the Rosa Valley and in the Watton-Waven, but we speak specifically Watton-Waven, and they're doing the works for us.
The parliamentary representative said excessive water and sulfuric activity in the area where the bridge is located is a concern. He told GIS News that a long-term solution may have to be sought to prevent the bridge from being undermined. The Rosa Valley MP said government has plans to construct a new bridge in the future to replace the existing one. This, he says, may require some land acquisition in the area as the road would have to be diverted slightly.
In the future, we may have to do a little bit of land acquisition in the corner there because we have some land slippage taking place there because of the thermal action, the geothermal action. I'm not talking about the one for generating electricity. I'm talking about the natural geothermal action and the springs and the constant erosion of the edges, and you have an edge failure because such springs are popping up from a daily basis. And these things have been happening since time immemorial.
Dr. McIntyre anticipates that work on the wing bridge will be completed shortly. And 19 healthcare providers, including 2 males, have been trained on how to provide voluntary counseling and testing services to HIV and AIDS clients. The participants received certificates of completion during a closing ceremony at the Prevo Cinemall Conference Room last Friday. The one-week training program is part of a series of sessions facilitated by the Ministry of Health through the National HIV and AIDS Response Program.
We've recognized the need to ensure that all our healthcare providers possess that skill to be able to provide quality service to the clients when they walk off the street. So this week we can proudly say that 19 persons have acquired that skill, and they're proficient, because we had to assess them, they're proficient to go out there and offer persons, as well as if persons walk off the street, talk to them on HIV, the risks and what it involves, what the test entails, and what services are available.
Trainer Mary Williams, in delivering an overview of the training exercise, said the training approach was participatory using mastery learning methods.
We ensure that learning is competency-based, which means that participants become competent in learning the skill. It is dynamic. It allows for feedback from fellow participants as well as trainers. And it is trainee friendly, which means that participants know from the very beginning what it is they're expected to learn, and they're guided to ensure that they achieve that goal.
Permanent Secretary in the Ministry of Health, Helen Roye, congratulated the participants on their accomplishment.
I hope your knowledge, which you have gained over this week, will be transferred to practical use, and the service provided to customers will be of a high quality, second to none.
Dr. Velda Wade described the training as informative, engaging, and comprehensive.
It is a new skill that will improve our patient care capability, as it will help us to give more holistic care to our clients. We did not only get to talk the talk during our sessions here, but also to walk the walk through our on-hand training on actual patients. That was amazing.
To date, more than 300 individuals in the health department have been trained in voluntary counseling and testing. In other news, a community health fair in the village of Mont Prosper last Sunday has increased the awareness of health risk among community members and motivated them to develop and make changes to enhance their personal health habits. The Health Fair Committee of Mont Prosper organized the event to demonstrate its concern about the incidence of chronic non-communicable diseases, or CNCDs, in that community. In 2008, the Ministry of Health revealed that the leading cause of death in Dominica was heart disease, stroke, diabetes, and cancer. Nurse Roslyn Daisy told community residents on Sunday that in Mont Prosper alone, statistics reveal that over the past 5 to 10 years, 24 persons from this community died as a result of complications associated to CNCDs.
Here in Mont Prosper, based on the last census 2011, our population was at 703, 377 males and 326 females. Although our statistics are not yet updated, but it shows that 8% of our population here in Mont Prosper is living with a diagnosis of hypertension and diabetes. Out of this figure, we have 29 females, and ladies, we have to do better than that. 29 females are diagnosed with hypertension and 18 females with diabetes. Ladies, based on our little population, that is much, much too high. We have to do better than that.
Health statistics also reveal that among the most frequent diagnoses in the hospital admissions at the Princess Margaret Hospital were heart disease, hypertension, diabetes, cancer, and stroke. Nurse Daisy said based on this trend, urgent action needs to be taken to reduce the incidence of CNCDs.
It is clear that the CNCD is a major cause of concern here for us in our community of Mont Prosper. So we need to determine in our hearts that we are not going to be part of the statistics of those living with hypertension, cancer, and chronic diseases. The major factors influencing the increase of the CNCDs are unhealthy lifestyle practices such as poor diet, physical inactivity. There is an increase in the consumption of high-caloric drinks, salt, sugar, and alcohol intake, with a corresponding decrease in the intake of fruits and vegetables.
The World Health Organization reported that internationally, almost 35 million people die every year as a result of the effects of CNCDs. In the Caribbean and Dominica, it is the leading cause of death. A call has been sent out for villagers of Mont Prosper to consume more fruits and vegetables.
We are the vegetable basket of the nation, and we want to encourage you to eat more vegetables and eat more fruits. Increase your physical exercise. As you do this, you will decrease your risk of developing hypertension, diabetes, stroke, and certain cancers.
Sunday's Community Health Fair in Mont Prosper was celebrated under the theme, Think, Live and Be Well, Fruits and Veggies Matter. In other health-related news, the World Health Organization and UNICEF have revealed that inequalities in access to improved drinking water and sanitation facilities still persist around the world. In a 2014 update released by the World Health Organization and UNICEF, data indicates that while the gap is narrowing, a disparity still exists in access to cleaner water and better sanitation between rural and urban areas. It states further that more than half of the global population lives in cities, and urban areas are still better supplied with improved water and sanitation than rural ones. But the gap is decreasing. In countries, the vast majority of those without improved sanitation are poorer people living in rural areas. Progress on rural sanitation, where it has occurred, has primarily benefited richer people, increasing inequalities. This is according to Dr. Maria Neera, the WHO Director for Public Health, Environmental and Social Determinants of Health. The report presents estimates for 1990 to 2012 and is based on data from nationally representative household surveys and censuses for the same period. It reveals that by 2012, 116 countries had met the Millennium Development Goal target for drinking water, 77 had met the MDG target for sanitation, and 56 countries had met both targets. MDG 7 aims to halve by 2015 the proportion of the population without sustainable access to safe drinking water and basic sanitation. The well-known efforts of the Labour Party government to improve access to potable water and proper sanitation has resulted in revolutionary progress in Dominica. Already, scores of persons have improved sanitation with the construction of washroom facilities for residents across the island. And with the commissioning of the Penrice water supply system, Dominica will realize 100% access to potable water. The Massac Canefield Primary School was the recipient of a surprise gift when the Rotary Club of Dominica and the Canada Rotary Clubs donated the ultimate child-friendly gift earlier this month.
The Rotary Club of Dominica, along with the Canadian Club, along with the Canadian Rotary Club, decided to give Massac Primary School a swing. And then, you know, we welcome that. If they could go on it from 8 o'clock, they would. But they are restricted because, as I said, they must be supervised. They sent down the playground and then they sent down their own workers. So the workers actually took time out to come and install it. But because of the ground, the nature of the ground, we had a contractor with them in order to help them to dig the holes and so. But it was really a great work that they did, and we do appreciate it.
Principal Daly says she is not clear on how or why her school was selected for such a gift, but that matters very little to the users.
Because the school is a very large school, we have over 300 plus students. Everybody can use it at the same time. So we have timetable the students. So every day we have 2 groups going to the swing. For example, we put grade K with grade 6, so the grade 6 students will have the grade K. We put grade 1 with grade 5, you know, like that. So then we always have supervision on the swing, and teachers to have to help supervise on a daily basis.
The playground was shipped to the school in parts and was accompanied by Canadian Rotary Club members who assembled it with help from locals. The principal says the effort and thought put into the gift is astounding and equally appreciated by the school.
Thank you to the Rotary Club of Dominica and Canada. Thank you to all the parents who assisted us, our teachers. Thank you. We just want to thank everybody who assisted us in making the playground a reality.
The Dominica Organic Agriculture Movement, DOME, in collaboration with the Ministry of Agriculture and Forestry and the Food and Agriculture Organization, the FAO, will be holding a members and stakeholders workshop to review and make recommendations to the following documents that represents the outputs of an ongoing consultancy. to initially develop a plan of action to support implementation of DOME's strategic plan, which clearly defines projects and activities, budgets and funding, and the implementation program, which pay attention to monitoring and evaluation. And additionally, prepare bankable projects as identified as priorities by DOME and project profiles of the remaining projects and activities to be found in the strategic plan. The plan of action and projects were prepared by the consultant, Mr. Joseph Peltier, who will present them at the workshop to DOME participants, various ministries, farmers, hotels, and other players in the organic food sector. The workshop, which commences at 8:30 a.m., will be held at the Prevost Cinemall Conference Room, located on Kennedy Avenue, Roseau, on Wednesday, May 28, 2014. The Honorable Minister for Agriculture has been invited to address the opening ceremony, at which Ms. Pilar Satokolma, an official from the FAO headquarters in Rome, will also speak. And that's the English segment of the news. We now join McPherson St. Luce for the Creole highlights.
Allô tout le monde, bienvenue à cette nouvelle en créole. Non, moi, c'est McPherson St. Luce. Premièrement, travail qui prend place bien formidable à l'école primaire en Charlottesville. Parole celle-là sortie au membre parlement, Honorable Ambrose George.
Newton Primary School, ça c'est un projet neuf. Nous avons maintenant construction. L'école là, c'est une école qui est à Dominique, à Charlottesville pour longtemps. Ça c'est l'école là qui était là déjà. Avec vivre en manière qui l'école là pas bon encore parce qu'il n'y a pas un environnement pour étudier pour ces enfants. Avec le gouvernement prend une décision pour bâtir l'école neuve à Charlottesville. Avec l'agence qui a sorti hors Chine, hors People's Republic of China. Le gouvernement avait payé une donation pour faire l'école ça. C'est l'école qui a trois terrasses avec qui est faite pour manière pour nous connaître 300 enfants qui allaient à l'école ça. Mais plus bonne facilité c'est bagaille neuf qui nous avons un élévateur à l'école là. C'est première l'école Dominique qui a un élévateur pour ces enfants qui challenge, qui passent à marcher bien, qui physically disabled. So nous avons fait l'école là avec un élévateur pour un service pour ces enfants ça.
Honorable George mentionné bagaille qui est en l'école là.
Il y a toute l'autre facilité, il y a un sick bay, il y a un library, il y a un hard court pour physical education là où l'école là. Mais là l'école ça a fini, c'est un bon édifice, un bon morceau d'infrastructure en Charlottesville, Meter Charlottesville.
Un autre nouvel projet diothermique qui a continué en communauté Loda. Parole celle-là qui a sorti au même parlement, Honorable Dr. John Colin McIntyre.
Nous avons regardé comme si nous avons test. Nous avons test ça nous là. Nous faisons tout pour aller pour descendre la geothermal energy et là. Et ça nous avons fait actuellement. Nous avons fait un test comme si nous avons fait sortir pour nous mesurer ça nous là. Et nous ni pour mesurer ça nous là parce que c'est ça qui est directé nous pour mettre qui va les plans nous ça mettre là. Pour acheter force ça nous là pour faire clairité pour mon Dominique. So mon bien côté ça nous qu'a fait actuellement tout nous qu'a regarder tout regarder safety et puis hazard comme si nous pas mais rien fait c'est monde qui a vivre Loda Trafalgar what nous sur ces places ça so nous qu'a mettre tout ça nous pour mettre en place pour protéger tous ces monde à Loda Kaichi et puis what nous so On compte pour ça, et bien, nous connaissons pour servir, nous faisons une production well déjà, nous fini, nous avons testé actuellement, et nous déjà nous tout là, nous faisons déjà, nous faisons 3D, loader, et puis production well à loader. So nous avons reinjection tout déjà pour mettre là. Et bien, c'est bien important, puisque si on est pour faire ces bails, nous passons un tir by hot terre. Ça nous a tiré, ça nous a vu mettre là pour nous son système comme tu dis ça couille il pas que moi c'est ça bon pour Dominique.
Étudiant l'école Kenfield Massacre a pris service en cuisine neuf qui bâti pour nourrissement ailleurs en l'occasion l'école Salan. Membre parlement honorable Ribbon Blackmore officiellement ouvert facilité là pendant une cérémonie lundi. Facilité ça là ouvert pour un service manger basé étudiant là. Et puis, il a tombé en bas programme School Feeding que le gouvernement a conduit en plusieurs écoles tout le pays là. Quand même si l'on coordinateur programme là parmi les guests, l'école Massacre Seyon en 40 qui a bénéficié en bas programme là. Membre parlement honorable Ribbon Blackmore complimenté l'école là pour l'éducation à yo 40 étudiants en bonne éducation. Honorable Blackmore aussi bien plaisir pour tienne pour mettre été fait par l'école là. Maîtresse l'école là, Elizabeth Daly, complimenté Honorable Blackmore pour faciliter là. Et puis finalement, projet Chimé Live si Wiki BNTF ka financier, car les plain field là, ça ka continuer. Membre parlement Honorable Ivor Stevenson, visiter projet là, check temps qui passé.
Nous ni BNTF projet encore, là nous ouais qui dans Chimé, dans place qui live Mahou pour descendre dans la plain field live civic. Nous qui bon travail fait là à la plaine ville ça là et puis monter là hier encore et puis mon qui actuellement il a fait dalle là pour chemin ça là bel timon sur chemin ça c'est un chemin qui est bien important il a aider monde pour trafiquer pour aller pour plaine ville là et puis community hall là ni health center là ni village council office. So, c'est un chemin qui est bien important dans le village là. Et puis, nous chemin ça dans la bonne manière, mais manière pour nous trafiquer dans la section village ça là.
Messieurs, mesdames, ça c'est toute nouvelle en créole pour à présent. Non, moi c'est McPherson Luce. Au revoir.
Find out the benefits of adding a little cinnamon to your food. That's coming up next on your tip of the day. Stay with us.
What's for dinner?
I know, but you want Cheryl.
Who? Cheryl? Oh, babes, that's nothing.
Nothing within there, but that is nothing.
Hon,
come on. Whatever.
You know you're my number one.
And she's number what, 10? Plenty married women get engaged from the husband these days. I don't want to be one of them. From now on, I'm looking out for me.
But babes, I only talk to the woman.
Until I'm certain this will take care of both of us, if you're lucky.
Your family depends on you. Don't take home aids.
In-studio discussions, insight, Creole News, Road to the Throne, Calypso, Creole Festival, Carnival, and lots more local programming. See it all on the Government Information Service, your first for local news.
Cinnamon has a long history both as a spice and as a medicine. A teaspoon every now and then could boost calcium and fiber levels as well as improve your colon health and protect against heart disease. Studies also link cinnamon with blood sugar control, weight reduction, and arthritis relief. And that's all for this edition of National Focus. We always welcome your suggestions and comments. Drop us an email at gis@dominica.gov.dm or visit our website at news.gov.dm. Friend us on our Facebook page, facebook.com/GIS News Dominica. You can also catch up on past National Focus newscasts on our GIS Dominica YouTube channel. On behalf of the news production team, I am Tarnia Green. Thanks for watching.